As we mentioned, a medical briefing on U.S. President Donald Trump's treatment just happened at Walter Reed Medical Center. Trump has been at the medical center since Friday to be treated for COVID-19. Our correspondent in Washington, Kate Fisher, joins us now. Kate, a very good morning to you on that end. So let's talk about this briefing. It's been anticipated after Donald Trump sent out a tweet message to his followers yesterday, being positive, but also saying that the next few days are going to be crucial.
That's right. He released a short video on Twitter last night where he did look paler than usual, perhaps not quite as punchy as he often is when he speaks to the camera. He wasn't wearing a tie, but he was up and speaking. And then this morning we have just heard from his doctors, from his medical team. Sean Conley, his personal physician, saying that he was very pleased with the progress that the president was making, that in fact that he could perhaps return to the White House as early as tomorrow to continue his treatment there, saying that he was walking around quite happily and getting on with his work. But he did give a lot more detail than he offered us yesterday. He has received a lot of accusations of not being clear and giving the American people the honest truth and information about what was happening with the president. And he did give us much more detail today, although crucially, still not specifics when reporters asked things like what was his fever, what exactly were his oxygen levels. We still didn't get any specifics on that, but he did say that the president's oxygen saturation level had dropped significantly twice. He's had 2 incidents of that where he had to have help with breathing, and that they were now giving him the steroid dexamethasone to help him with his lungs. And also he's continuing that course of remdesivir, a therapeutic that has been shown to help some people with COVID-19. Of course, these drugs as yet have not been approved by the Federal Drug Administration. They're still in clinical trials, but his doctors have been giving them to him. So he's trying to paint a rosier picture today, but clearly the president is still not well.
And Kate, that's what I found quite intriguing about President Trump's message via Twitter, because even though he was positive, he was also very much in acknowledgement of, for instance, the difference in age between him and the First Lady, and that she seems to have better chances of getting through this purely based on her age. So acknowledging that COVID-19 can be a very serious ailment, and him being at that age could very much surrender to that.
Yeah, that's right. He hasn't paid much public lip service to the dangers of COVID-19. Up until now, he's generally tried to suggest that it is not as big of a problem as scientists are telling us, and he's tried to play down the fears about it. But now he's suffering from it himself. He does seem to be a little bit more humble about these things. And yes, he noted that he is, I mean, at 74, the First Lady is 50. He's quite a bit older than her, and perhaps in not such good shape. So it is likely that he's more likely to suffer greater side effects, or for this disease to affect him in a more serious manner. And of course, she is still at the White House. She has not been hospitalized for her symptoms. Yeah, that video, he was suggesting that he was very grateful to all his supporters and all the medical staff there. And he did say, although he felt good, that he acknowledged that the next 48 hours were very important and that he would be monitored closely during them.
And when we're talking about timelines, it was quite also interesting to see that Jason Miller, the Trump campaign senior advisor, failed to answer the question on why it is the president continued to go to Bedminster for a fundraiser. Why was he having difficulty to answer the question on the wisdom of the decision, especially if they say that President Trump was diagnosed positive on the timeline that they gave, and that he was no danger to anyone?
Yeah, there is a lot of misinformation and a distinct lack of clarity about this timeline. We still don't know when the president was exactly diagnosed, when he started to feel symptoms, and when his last negative test was. All those questions have been asked by reporters, and there still isn't a clear answer on any of them. But yes, certainly the people that attended, for example, that donor event in New Jersey at the President's Golf Club there, may well have a lot of questions, because it appears that the president mingled with them in the full knowledge that he was infectious, that he was a positive for coronavirus. And as we know, he doesn't like to wear a mask. That event was indoors, so there may well be a lot of people there very concerned about their own health, and also asking questions about why they were put in such a risky situation. We understand that the authorities in New Jersey, the health authorities there, are starting a contact tracing program to try to reach the people that were there and to see and get to check their symptoms, and for them to go and get medical help if they think they might have caught it.
And would that include the New Jersey senator?
Well, the New Jersey senator is a Democrat, and so was not at the fundraiser for Donald Trump.
So there was no interaction at all?
It was Republican Party donors. Yeah. But the New Jersey governor, Chris Christie, former New Jersey governor Chris Christie, has tested positive. He was one of the people that was helping Donald Trump with his preparations for the presidential debate. That was just last Tuesday when he faced Joe Biden on that televised debate. Chris Christie was helping the president to do that, and he now has also become positive with coronavirus and has checked himself into hospital.
Okay, just a quick question, Kate. Any other reaction, any other news coming out of DC? You've got the White House in the background there, and I'm thinking just with news that the president could be returning there as early as tomorrow. Any other reactions that have taken place today amid this news?
Well, I think one of the most significant changes is that yesterday there was this hugely contradictory statements between the president's physician, Sean Conley, who's just spoken this morning, saying that the president was doing well and giving a very upbeat version of events, and then the president's chief of staff, Mark Meadows, who offered journalists an off-the-record statement saying that there had been a very concerning time for the president with his health. Dr. Sean Conley, his doctor, was asked this morning as to why he gave one version and the chief of staff gave another, and Sean Conley said, look, yeah, that was a mistake. I was trying to give a good, an upbeat kind of put it in a good form. I didn't want to kind of give anything, I didn't want to make anybody think anything negative about the president, but I did not tell you everything. He did have these drops in his oxygen saturation levels. So a little bit of a mea culpa today from Sean Conley, who essentially yesterday, when he was asked about how serious it had been, said it hadn't been serious. This morning we're now learning that in fact it had been. The president's oxygen levels had dropped dangerously and he'd had to be given help breathing, and that is part of the reason why he was hospitalised. So a bit more of a clearer picture today, but still not those specific questions from journalists are still not being given. The answers are not being given by the medical team.
All right, thanks a lot for that, Kate. Kate Fisher, our correspondent there in DC, and we will be speaking later on to our correspondent in New York, Sherwin Bryce Pease. He'll have more on the international slot at 8 tonight, because the news comes as more Republican senators raise questions about Barrett hearings, as more of them test positive for COVID-19. So we'll hear how all of that has interacted with the latest developments in the U.S.